The words we're hearing to describe this situation, we heard Dr. Bogosh: crisis, burden. Others say it's overwhelming, that there is a burnout factor. Describe for me what words you would use as you walk through your emergency room department.
You know, I think you just nailed it. Every vector is sort of aligned to create the crisis that we're in right now, and our staff are burnt out, but we are also starting the day with a depleted number of staff every day. Staff are getting sick in numbers that we just haven't experienced before. So you add that onto burnout, and you add that onto, high acuity and sick patients coming into the hospital, and it creates a very difficult environment to work in.
Who is it affecting most, would you say? You've talked about the burnout among staff. I've certainly heard that story, in many forms before. Who else is it hurting?
I mean, it's all of us in society, right? So certainly our staff are burnt out, but I understand the patients are burnt out, people are burnt out. This is difficult for everybody. Let's keep in mind that we are fortunate that at least those that are triple vax, that have had their boosters, are experiencing only mild illness and not severe illness. And so continuing to push forward with our vaccine efforts, especially in vulnerable populations and in pediatric populations, is something we need to keep doing to try to protect our health system capacity.
What do you say to the people who are in hospitals right now, who are unvaccinated, who can pass on the virus just as somebody who is vaccinated can also do?
The key here is about outcomes, right? And so for those people that say, well, what does it matter if I could get Omicron, whether or not I had a vaccine? It does matter, because just because you get an infection doesn't mean that you're going to experience that infection in the same way. So those that are unvaccinated are far more likely to be admitted to hospital, and layer that on, they're far more likely to have bad outcomes, meaning ICU outcomes, meaning needing to be on a ventilator. So it is not the same. So getting an infection and having an experience that feels like a bad cold or a bad flu and being able to manage that at home, if you're triply vaccinated, is very different than if you're not vaccinated or enter in the hospital facing potential ICU admission.
And let me ask you this. Is there, and I know you're going to say no, there's no difference in treatment. Is there a difference in attitude when somebody comes in and needs care, they are unvaccinated, versus someone who is vaccinated and still needs to be in hospital?
So absolutely no difference in care. And when it comes to attitude, frankly, that's not our job. Our job as physicians is to provide the standard of care, no matter who the patient is sitting in front of us, and not to make judgments about what led to those patients' decisions. When we're outside of that patient room, is there frustration amongst hospital staff? Of course there is, because you do see the situation where somebody's unvaccinated and say, that was potentially preventable. And that's where there is frustration and frankly some sadness. But when the patient is in front of you, every part of you is just concerned with providing that patient the treatment that they need and the fighting chance that they need. End of story.
And let me ask you your story, doctor, because everybody's got one during this pandemic. It's been months, and I've talked to so many people who are affected in so many different ways. You are there on the front line. I'm wondering how this is affecting your head, your heart, your sense of what your world is like.
There's, like anything, there's days that are harder than others. You look for your silver linings, you look for your support mechanisms, and when you're in the middle of a crisis, you have to push through, and that's the attitude. I think that when that crisis starts to settle, then you sit back and you sort of work through your feelings and you process all of that. But in the crisis, your job is to just push through and do what you have to do as a doctor, and so that's what we do.
I want to thank you for your time, doctor, and you be well, okay?
Thanks, Johanna. Take care.
Dr. Tasleem Nimjee in Toronto. She is an emergency room physician at Humber River Hospital.